Welcome back, everyone. It's a big weekend for some Philadelphia businesses. The city of Philadelphia will begin lifting some coronavirus restrictions, including the resumption of indoor dining at 25% capacity. Joining us live once again is Philadelphia Health Commissioner Dr. Thomas Farley. Good morning, Dr. Farley.
Good morning.
So if you could, please talk to us about the decision to lift the restrictions starting this weekend.
Well, we had an uptick in cases after Christmas and New Year's, which we expected, and we thought it would be falling about now, and it looks like it is. And so we do want to keep the economy going, and so we are carefully and cautiously easing back on some of our restrictions, including, as you said, letting restaurants have indoor dining at 25% capacity and raising the capacity limits for some other settings.
What other businesses are we talking about operating with fewer restrictions?
Well, theaters are going to be able to open now. They were closed before. And other places that were at 5 persons per 1,000 square feet, they'll be at 10 persons per 1,000 square feet. So still, it's reduced density for everybody, but it's a little bit easier for people to get around. Now, I don't want anybody to take that as a sign to not wear a mask or get together. The case rates are still very high.
I have to ask, is there a chance that you'd reverse course if there's another significant spike in cases after the reopening?
Absolutely, there's a chance of that. You know, this virus is unpredictable. It's gotten worse before. It could get worse again. And if we feel we need to, we might impose these restrictions. I hope not, but it could be.
Let's talk a little bit about the vaccination process. How do people in Philadelphia stay up to date on the rollout and the phases of eligibility?
Well, our website, www.phila.gov/COVID, talks about all of the things we do for this epidemic, including our vaccinations. There's how many people we're vaccinating and indicates where we are. And there's a guidance document there that says what all the priority groups are in our ranking, phase 1A, 1B, 1C. Right now, we're still in 1A, only healthcare workers and people in long-term care facilities. But we'll let people know when we get beyond that.
And people can sign up on the website to be alerted as well, correct?
Well, you know, there's a lot of confusion around this. There is a nonprofit organization that has set up their own website for sign up. We would, are hoping to put up a sign up for the city of Philadelphia. That's not up yet. So I would actually prefer people wait until our sign up is established.
Hold off on that. Okay. Well, let's ask about the effectiveness of the vaccine. Can people still get the shots, the vaccinations, and still contract the virus and pass it along to other people?
Well, you know, the vaccine is excellent. It's 95% effective. That's not 100% though. So yes, if you're vaccinated, it's still possible you could get the infection. And it's a theoretical possibility that you might not actually get ill, but get the virus and still be able to spread it to someone else. So even people who are vaccinated need to continue to wear masks and keep their distance from others.
Let's talk a little bit more about the challenges with people gathering in homes or merging households. I mean, obviously, even if people go out for indoor dining, you don't want them to be from separate households.
Yeah, you know, the biggest areas of spread right now are within households, and then when one household visits another. And so we really ask people, don't mix with people outside your household. Don't invite people over. No sleepovers for the kids. No gatherings with the relatives.
How are the cases looking right now? I mean, obviously, we've passed by the holidays. I mean, are they tracking downward at a significant pace, or are they just kind of leveling off?
You know, we're up about 500 cases a day, but it does seem to be going down over the last 2 or 3 days, and we have other indicators we're looking at that are looking good. So I think we're on a decline now. I can't say how rapid it is. Everybody still needs to be very serious about this. I'm hoping that maybe we're starting to see the turnaround for this winter wave.
Okay, light at the end of the tunnel. Dr. Thomas Farley, we appreciate your time, sir. Continue to be healthy and safe.
Okay, thank you very much.
Thank you.